At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Village health volunteers and self-reliance of communities in disease prevention and control. Ban Pa Sub-District Scenario. Located about 100 kilometers north of Bangkok, Saraburi is a province in the central region of Thailand. The province has abundant natural resources, including the main waterway, Pa Sak River, and large limestone sources, as well as a large number of industrial plants. As dengue hemorrhagic fever, DHF, has been more widely spread as one of the public health problems in the province, efforts have been made to develop a surveillance and rapid response team, SRRT, one for the provincial level and one for each of the districts, sub-districts, and villages. The case study was initiated at Gang Khoi Hospital, a district-level hospital in Saraburi province, with the aim of providing medical treatment for DHF patients with rapid diagnosis, complication prevention, and life loss prevention through the use of its modern laboratory, ready for rapid diagnostic services. Dr. Prasichai Mangchit, Director Gang Khoi Hospital, said that the district's policy on disease control competent district requires multi-sectoral cooperation. We give importance to the capacity building of sub-district SRRTs with technical support from the health sector and financial and managerial support from local government organizations, LGOs, as well as the private sector. In this effort, we have been trying to change from the hospital-based curative care approach to health promotion and disease prevention for the people to be healthy. Similarly, at the sub-district level, Ban Pa Sub-District Health Promoting Hospital is holding a meeting today to discuss ways of dealing with the outbreak of dengue hemorrhagic fever in the community in case it occurs. The effort has obtained cooperation from various sectors, including LGOs, the private sector, and village health volunteers, VHVs. The emphasis is placed on the DHF surveillance and control at the sub-district level, based on the technical principles and timeliness. Health officials have to provide knowledge and serve as mentors for the village health volunteers, who are the key workforce so that they are capable of performing the DHF prevention and control activities, using different methods with confidence. เสริมศักดิ์คำพิลานนท์ Health Technical Officer บ้านป่า Sub-District Health Promoting Hospital said that despite the limited number of health personnel, we've got village health volunteers who are local residents with a good knowledge of the locality and local problems. The volunteers are able to give information about the local situation, notify health officials of the event, and get access to the community rapidly. Thus, they are the key workforce in disease prevention and control. Moreover, we have created the SRRT network at the sub-district level through multi-sectoral cooperation and support, making the work more efficient. This place is the coordinating center of the sub-district surveillance and rapid response team, located in village number 5 of Ban Pa sub-district. Actually, it is the house of Thongkun Sipantha, chairperson of the Village Health Volunteers Club in the sub-district. Today is one of the days that the members of the sub-district and village SRRTs go out to perform their duties with health officials from the Kengkhoi District Health Office and the Ban Pa Sub-District Health Promoting Hospital, serving as observers and mentors. Their focus is to end or contain the DHF outbreak as rapidly as possible and prevent it from spreading to other communities. DHF is a communicable disease transmitted by the bite of an infected Aedes mosquito, and its spread can be very fast. So to prevent and control the outbreak, all measures are to be taken for all households in the affected community on a continual basis throughout the year. Public communication efforts are to be made for the people to know that there is a DHF outbreak in their community, educating them about disease prevention and protection from the bites of Aedes mosquitoes. Control of Aedes breeding places and cooperation in eliminating Aedes breeding places that may have been left unnoticed in the community. The measures against Aedes larvae at or near the patient's house are to be undertaken within the radius of at least 100 meters from the house. Some solid waste, such as water bottles, can be reused or modified as a larval trap or a little bottle waiting for larvae. It is an innovation that the community is proud of. Several village health volunteers are producing larval traps made of used water bottles. Another urgent measure for the outbreak prevention and control is chemical spraying against adult mosquitoes in the area that is the source of infection. It is the method of reducing the number of infected Aedes mosquitoes in the community. Regarding the supplies and equipment for this purpose, they are provided by the private sector in adequate quantities and usable conditions. Thongkun Sipantha, chairperson of the Village Health Volunteers Club in Ban Pa Sub-District, said that our locality is at risk of DHF outbreak. So, in addition to having the sub-district SRRT, we also have a network of village SRRTs. Each village SRRT is headed by the chairperson of the Village Health Volunteers Group in each village. We have volunteered to help the health sector, as we want to participate in resolving the problems in our communities with large areas and population. State health officials might not be able to cover all localities, as we are close to the communities. Whenever an incident occurs, we will know first and are able to get to the site to do the preliminary case investigation and disease control actions, and then notify the health official immediately. The strengthening of the SRRT network at the sub-district and village levels is the key to the health emergency response in an efficient manner, according to the Health System Development Direction of the Ministry of Public Health, that aims to enhance community participation and self-care for lessening illnesses and health threats in a sustainable manner.